Good afternoon. I would like to call our October 15th, 2024 Health and Human Services Committee of the Board of Mecklenburg County Commissioners to order. Welcome, everyone. We'll start customarily introducing board members, but I do want to say a hearty welcome to those who are online and those who are guests in the audience today. Starting from my right, since there are two members of the four-member committee that's present, one is ill and at the doctor, and so we'll start with my committee member to my right, and then we'll go to our honorary member after Commissioner Powell. Please introduce yourself.
Good afternoon. I am Mecklenburg County Commissioner Elaine Powell. I represent all of North Mecklenburg, which is County District 1.
Our honorary member down on the end, please introduce yourself.
Thank you, Mr. Chairman. My name is Susan Rodriguez McDowell, elected by the people of District 6.
And I'm Arthur Griffin again, elected by all the folk of Mecklenburg County. I serve as a commissioner at large. Welcome, welcome, welcome. I'd like to introduce our executive team first, and then our guest. So I will go to my immediate right, Mr. Troutman.
Good afternoon, Anthony Troutman, Deputy County Manager.
Delisa Tolbert, Community Resource Center Division Director, representing Department of Community Resources.
Good afternoon, Stacy Lowry, Director of Community Support Services.
Good afternoon, Kim Henderson, Director, Child, Family, and Adult Services.
Good afternoon, Radar Washington, Public Health Director.
Good afternoon, Taya Cruz, Assistant to Deputy County Manager.
Afternoon, everybody. Robert Nesbitt, Health and Human Services Chief of Staff.
Okay. We have some Mech Success 2 folk behind us.
Yes.
Good afternoon, Denise Sills Ballard.
Good afternoon, Denise Sills Ballard, Department of Community Resources.
Good afternoon, I'm Dana Howie. I'm from the Department of Community Resources at Real. Good afternoon, I'm Lizette Nimmons, Intergovernmental Affairs Manager.
And our guests who are not presenting, because we'll get your introduction once you're presenting.
Greetings, Joe. My name is Stephon Snelling, Training Development Manager.
Okay.
Good afternoon, Kimberly Conyer, Family and Children's Medicaid Manager, Economic Services Division.
Good afternoon, Elise Massey, Assistant Division Director at the Economic Services Division.
Good afternoon, Lynn Martin. I'm the Adult Medicaid Manager.
Good afternoon, Julio Rosales, Quality and Training Supervisor with OSI.
I'm Wendy Bost. I'm Senior Quality and Training for Medicaid.
Good afternoon, Denisa Concepcion with Transitional to Excellence Supervisor with Medicaid.
Hi, I'm Abby Wyatt, the Livable MEC Manager with Health and Human Services.
Good afternoon, Tim Gibbons, Program Director, Early Childhood Initiatives with our Department of Child, Family, and Adult Resources or Services.
Good afternoon, I'm Diana Jolly with Child Care Resources.
And that appears to be all of our guests other than the presenters, and they'll introduce themselves when they come up to the microphone. Before I call on our deputy county manager to introduce the first presenter, since it's just the three of us, can we go through these four and take notes and then come back, or would that work? Would that work?
It would work, but it's always easier if we do it right after the presentation.
All right, but okay, we'll do 3 minutes and we'll keep it rolling.
Okay.
All right.
Thank you.
All right, before I call on the deputy county manager, this topic is extraordinarily relevant and important. I haven't shared this with my colleagues yet. I did have a conversation with the Speaker of the House, Tim Moore, and our Senator Pro Tem, Phil Berger. One of the questions that I posed to both is, as we're trying to be innovative in moving people from assistance to living wage, I've heard of something called the benefits cliff, and we really need to drill down a little bit and see if there are opportunities through state waivers or federal law, et cetera, to help us. But before we go any further, myself and others need to understand a little bit more what we mean by benefits cliff other than childcare. So with that said, Deputy County Manager, and the caveat, as the presenters are presenting, try not to use a lot of acronyms, just kind of, spell it out for us slowly as we go. All right. Thank you, sir.
Well, thank you, Commissioner. Today, we have three programs that we're going to present. One is our child care program, Medicaid, and then Livion is going to present on the Housing Choice Voucher Program. And the additional program that's not being presented today is our food assistance program, but there's a larger presentation coming with that. And so I'll turn it over to Robert Nesbitt as our first presenter.
Good afternoon, Chairman Griffin, HHS committee members, Deputy County Manager Trotman, our Human Services leadership team, and all the guests here today. As I said earlier, I'm Robert Nesbitt, Chief of Staff for our Health and Human Services Agency, and glad to be here. And this has been touched on a little bit by both Chairman Griffin as well as Deputy County Manager Trotman, but our goal for today's presentation is to highlight challenges, opportunities, and investments related to benefit eligibility thresholds across various programs and outline their impacts on economic mobility for families. We will specifically focus on eligibility for resources such as Medicaid and child care subsidy, and those are managed by the county with our partners such as Child Care Community Resources, and housing vouchers managed by Enlivion. Our presentations today will provide household examples because we really wanted to show the kind of impact that these thresholds have on families. Want to emphasize these are just examples and case details vary family to family. But we really want to highlight that even when there are opportunities for career advancement and increased earnings, it can be very challenging for a family to give up public benefit assistance. And that relates to not only the benefits cliff, but a few other intersecting issues as well. And that's what I have on this slide. So along with the benefits cliff, which is a very common term that's discussed, there are some other dynamics at play. We'll start off with just the benefits eligibility thresholds. And these are the basic kind of cutoffs for different programs. Every benefit has its own threshold that can be the level of income for a household that's allowed can be determined based on household size. And in some cases, factors such as expense deductions or taxes that a family may owe. The benefits cliff, which is what is most commonly discussed, relates to when a household has a benefit, but then as their earnings increase, they lose that benefit. And so that's where that cliff expression comes in. Sometimes there are benefits that are gradually reduced as a household's earnings increase, but other times there are benefits that when you cross over that threshold and your case is reassessed, the benefit is gone completely. And so the increased earnings may not make up for the loss of benefits. there are also coverage gaps. And this is something you hear when discussing Medicaid. So you'll hear the Medicaid coverage gap. And this is often talked about when it comes to states that have not expanded Medicaid. And luckily, North Carolina, as you'll hear more about in just a few minutes, is one of now those Medicaid expansion states. But prior to that, there was a large gap of coverage. Many households in dealing with poverty who were not eligible for Medicaid. Housing vouchers also kind of apply in this circumstance, that due to federal funding and state funding and certain policy limitations, there are not enough housing vouchers for people in need of assistance, even though many households are eligible. Then there are eligibility gaps, which have to do with the households that are just over income limits. So when households apply, even if they're sometimes just a few $100s over a certain program eligibility limit, they will be denied. So wanted to highlight all of those. There are some things that you all are doing, particularly with childcare, that are all addressing some of these issues, and I'll discuss that in just a bit. But I wanted to frame our conversation with all of these different dynamics at play. I can take questions now, but I can also just go ahead and have Broderick discuss Medicaid, but we can go.
Yeah, let's get Medicaid up, and then if we have questions or specific regarding the cliffs, the coverage or eligibility, we'll ask Roderick.
Cool.
Okay. All right. Thank you. I said Roderick, it's Broderick.
Yes, Broderick.
Thank you.
Thanks, Robert. Good afternoon, Commissioner Griffin and the Health and Human Services Committee members, our Deputy County Manager, Anthony Trotman, our Department Director, Yolanda Griffin, in her absence, and the Health and Human Services Leadership Team, our Mecklenburg County residents and guests. My name is Broderick Knight. I am the Assistant Division Director within the Economic Services Division in the Department of Community Resources. I am also I oversee Medicaid, our Quality and Training Unit, and our division personnel. Today, I want to present on the overview of Medicaid eligibility thresholds to the regarding residents of Mecklenburg County, as well as exciting updates surrounding our Medicaid expansion. I also would like to introduce a couple of our Medicaid gurus. I brought the Dream Team with me, which you heard of Denisa and Wendy, and then we have our Medicaid managers who are here to help answer any questions at the end of this presentation. A year ago, our Medicaid leadership team, Kim Conyer and Lynn Martin, presented to the committee offering an overview of Medicaid programs and the complexities involved in the evaluation process of Medicaid. And I have to say this process have not changed. As we look here at slide 5, evaluating Medicaid programs, our applications requires residents to meet specific income thresholds. These thresholds can vary based on several factors such as age, pregnancy status, and various health conditions. There are income exclusions and deductions that allow a degree of policy flexibilities when reviewing applications and approval. Even if one household member isn't eligible for Medicaid, others in the household may be eligible for Medicaid. Medicaid expansion. Medicaid expansion went into effect on December 1, 2023. The income limits increased between 133 to 138% of the federal poverty level. Over 33,000 residents in Mecklenburg County transitioned immediately from limited coverage to full coverage. By December 2024, we anticipate that over 52,000 new Medicaid beneficiaries will result from this expansion. I would say as of today, we have over 49,000 new Medicaid beneficiaries. By the end of 2025, we project to have 67,000 residents receiving benefits through Medicaid expansion. Here we have a year-over-year comparison of our Medicaid programs. As you can see in this chart, there have been significant increase in our Medicaid programs from fiscal year 22 to fiscal year 25. We are projecting that 44% increase in applications, 42% increase in our renewals, 39% increase in total participants. As of September 30th, we have over 399,000 participants in Medicaid, which is a 27% increase from FY22. This illustrates the growing need for this vital resource within our community. Our Medicaid monthly income limits. This slide provides a snapshot of Medicaid monthly income limits ranging from a single adult to a family of 5. For example, the income limit for a family of 3, including a pregnant woman, is $4,218 or less. For children ages 0 to 18, the limit is $4,541 or less, while adult ages 19 through 64 have a limit of $2,862 or less. In addition to Medicaid, I want to touch on the Affordable Care Act, which offers 4 categories of plans available to households who are over Medicaid eligibility thresholds. This plan includes the Bronze Plan, which is a high deductible, the Silver Plan, which is a moderate deductible, and then we have the Gold Plan and Platinum Plan, which are low deductibles. There are also catastrophic plans available for individuals under 30 and some people with limited income. If a resident is denied Medicaid or has their active Medicaid case terminated, they can apply for health care coverage through healthcare.gov. Residents have 60 days from the denial or termination dates, which occurs as qualifying events, to enroll outside of open enrollment, which occurs November 1st through January 15th. In this slide here, we have 2 scenarios to show how a household who is eligible and a household who is no longer eligible for Medicaid and could receive low-cost coverage through the Affordable Care Act. Here we have a mom with 2 children, ages 12 and 13. Scenario 1, they're Medicaid eligible. Income is $35,000 a year. After tax, their monthly income is $2,396 per month. In this scenario, we have a median of rent of two-bedroom apartment at $1,500. Additional household expense of an average of $800, which may include food, utilities, clothing. As you can see, their budget is still tight with Medicaid coverage, which is a challenge with poverty. In scenario 2, this same family is ineligible, making $1,000 more, $36,000 a year. After tax, $2,459 per month. And they choose the Bronze Plan, which is a high deductible. This may help this family without having to pay a monthly premium, but the challenge will be if they must pay out of pocket until they meet their deductible. This is the reality of what families face and potential risks that it takes to give up their Medicaid. Some key challenges here is that we have the policy flexibility to approve families who are close to the threshold for Medicaid eligibility. Even the ACA coverage, there are many financial challenges for families above the 138% federal poverty level. The lowest cost ACA plan have high deductibles that can place a financial burden on households during healthcare emergencies. Some key takeaways: Medicaid coverage access has expanded significantly in our state with Medicaid expansion. There are low-cost options through the Affordable Care Act for households that remain above the eligibility thresholds. We advise individuals who are ineligible for Medicaid to utilize the healthcare.gov for access to affordable insurance. There are community resources that can help households with high deductible health coverage plans through ACA, but many households are naturally hesitant to give up their Medicaid because of high cost deductible with the ACA plans. This concludes, Commissioner Griffin, my presentation on Medicaid, and I am happy to answer any questions at this time. I will ask that my team please come by close to help answer these questions.
Mike, thank you very much. I'll go to my colleagues for 3-minute rounds until about maybe get 2 questions in maybe, and then we'll go from there. Commissioner Powell, you get the first question, ma'am.
Do you have an idea about how big the deductibles are on the bronze plan?
When I looking at through the ACA, the deductibles could range from an individual paying as high as $6,000 for an individual and $12,000 for a family.
And so my understanding is it's 0 on the Medicaid.
Yes, the premium.
Do you see other issues where families are hesitant? Because you said I was writing that the benefits are hard to give up when there is no cliff. Do you see other areas where it's hard to give up benefits or just related to health insurance?
I can take that one. Yeah, there are many other areas, and we're going to talk about that some momentarily, even with childcare, for example, and in Olivia's presentation. It is a challenge across not just healthcare, but just really across benefits. So yes, this is not Medicaid alone where this can be a challenge.
Thank you. That's all I have.
That was quick.
Yeah.
All right. Commissioner Rodriguez-McDowell.
I actually don't have any questions. Thank you for the clear presentation.
All right, thank you for the invite.
One question on Medicaid. Can you have a split household? Can the children be eligible and not the adult in the household?
Yes.
Could somebody kind of explain that a little bit? I mean, is there an eligibility cap, for example?
Yes, sir. I don't know if you remember the slide that he showed the income limits based on the ages. So depending on the age of the person, we will look at different income limits. So for children, as you can see, we love our children. So the income limits are higher for our children. So therefore, we will look at a different income limit for our children, and they will be probably eligible at that time while the parents may not be eligible. So therefore, you may have a household size of 4 with 2 parents and 2 children, with parents not eligible for anything, and then children are eligible for coverage.
And so what about the household income?
The household income will count for everyone.
For everybody?
Yes, sir, because they're still parents of the children, and that income counts for those children. Yes, sir.
The income limit on the very end where it says 19 to 64, that's the Medicaid expansion.
All right.
Wait, I got totally lost in that. I'm so sorry. But I thought I understood.
I was just trying to see if there was a way to separate children to be eligible for Medicaid.
Because they don't have income.
Right.
So
we look at it as a individual. We in Medicaid, we take individual people and look at them individually. Will the mom be eligible? Will the dad be eligible? Will the children be eligible? Well, based on the Affordable Care Act, a parent's income counts for a child because they're financially responsible for that child. So any income in the home that the parent may have is going to be countable for the child.
Oh, of course. Okay.
And the projection is 439,057 by the end of the fiscal year in terms of increase.
Yes.
Medicaid enrollment in Mecklenburg County.
Mecklenburg County.
Wow, our population is 1.18 million, something like that. All righty, thank you very much.
I thought of a new one.
You thought of a new one?
Thought-
All right, alibi.
How are you basing these projections? Like, where is that coming from? That almost half the population would be eligible?
So what we do is that we look at from month to month, we are projecting what the applications that are coming in. That's how we project month to month what we're seeing, which we're seeing increase in applications. So our management analysts, they have their calculator to project what that's going to look like.
Thank you.
The initial data came from the state as far as the number of potential eligible individuals in the entire state, which is how they came up with the budget. And our numbers were specifically for Mecklenburg County. And so they're looking at the number of applications that they receive, the number of denials, the number of approvals, the number that are in process to determine those projections.
And like, you know, how do we compare to other counties? It's just so extreme.
This is consistent with other large metropolitan counties, not just in North Carolina, but throughout the country that expanded Medicaid. And we can provide some data in comparison to other large counties. And we can send it after this meeting.
Thank you.
Yeah, because just Medicaid expansion alone, you know, 16,000 we additional approved from the 33,000 that transferred over. So it's definitely increasing.
Thank you very much. Deputy County Manager Trotman or Mr. Nesbitt to introduce the next segment.
So everybody, I am back for this next segment of the presentation. And for this portion of the presentation, and thanks Roderick and team, that was a good overview of Medicaid. I'll discuss childcare subsidy and some work you all have done to expand eligibility and work to prevent families from losing benefits as well. But I'm going to go over some of the key barriers, kind of similar to what we did with the last presentation, give a couple of household examples of how this plays out in the real world for families. With childcare subsidy, there are two key barriers to families gaining access to this resource. And these are two of the items that I mentioned at the front of this presentation. One is the eligibility gap. And that is, again, that's where families don't qualify for subsidy in the first place because their income is too high. So as I mentioned before, they could have a household income just $1,000 over that income limit, even much less than that, and still not qualify. And then there's the benefits cliff, which is where families are receiving this childcare subsidy benefit, but then as their earnings increase, they lose that benefit. They hit a certain point where that benefit goes away. The eligibility gap, I'm going to dig in a little deeper on and give some details for the thresholds at our state level. This for children ages birth to 5, families must be below 200% of the federal poverty level to qualify. And so that's, you can think of those 0 to 5 kids. I've got a 3-year-old at home, so I know what this is like day to day. It's a challenge. It's for the full-time daycare. And that would be $51,640 for a family of 3. That's the limit. So if a family earns more than that, they are not eligible for childcare subsidy based on state guidelines. For children ages 5 to 12, this is for kids receiving after-school care. Families must be below 133% of the federal poverty level, which is $34,340 for families to be eligible. So again, if families are below either of those thresholds, based on the age of their children, they will not qualify for subsidy per state policy. I've got an example here that shows what this is like for a family. Imagine a mother who has 2 kids, ages 3 and 10, and she makes $52,000 per year in her total income before taxes. This comes out to $3,461 per month after taxes. And here you can see at this income level, she's just over that state threshold, but she would not qualify for childcare subsidy. With this household budget, we project $1,700 on rent, $1,875 for childcare, and these are based on averages. These are not even these are not at the high end. This is just at the community average for having a 3-year-old in full-time daycare and a 10-year-old in after-school care. And then additional household expenses, as earnings go up, people tend to spend a little more on extra items, so additional expenses at $1,500. And in this scenario, you can imagine without childcare assistance, this family would have a shortfall of funds of $1,600. And you can see this is not necessarily an unrealistic household budget, but this is what families are up against naturally with the state thresholds. I'm going to talk in a little bit about investments you've made to address this. The barrier number 2 is the benefits cliff. And so again, that's when families are receiving the subsidy and then they lose it as their earnings increase. Our state sets the cliff at $64,000, or the limit at $64,278 for a family of 3. And that's 85% of the state median income. There is a bit of a gradual increase. So a family can be approved and their earnings can increase, but once they hit this point, that's when they will lose their childcare subsidy assistance. Here, I'm going to show you what this could look like for a household. So you have a family that a mom with 2 children, ages 3 and 10, and she earns $65,000 a year. So just over that previous threshold. Now you can see that she's again paying $1,700 in rent, but with the childcare assistance, she brings her childcare expenses down from $1,875 to $542. And that's a standard copay that's set by the state government. It's a 10% copay based on annual income. And so that's or monthly income, but the exact calculations we can provide details on, but that's a standard copay, but it's a huge reduction in costs. And then additional household expenses of $1,500. And you can see she would have $450 left over at the end of the month with her childcare subsidy. But as she approaches that benefits cliff and loses that assistance, she goes from having a surplus of funds to being in the red, nearly $900 each month. So I say all that to really highlight the challenges that families face both in accessing childcare subsidy and maintaining it as their earnings increase. And in this scenario, this would be about $11,000 per year in a financial impact that would have for this mom and her kids. But there's some good news in this story, and that's related to work we've done locally, thanks to your all's support and dedication as a board. Beginning in FY23, the county invested $10.5 million for a 2-year pilot program to expand eligibility for working families, and that helped to address both the eligibility gap and the benefits cliff. You all supported us in investing an additional $25.75 million to grow this program and sustain it through FY25. And it's been an extremely successful program. It's helping families earning in that area between 200 and 300% of the federal poverty level, so up to $77,500. So created a huge way to help families that had not been done prior in our state. We've served 2,050 children from 1,540 households, and this is just our latest data. We have paused open broad enrollment right now, but new families are added as there is natural attrition with children either aging out of childcare or perhaps families moving out of the area. This project and effort has been paid for with underspending from our childcare subsidy budget over the last few years, and that's because there's been federal pandemic relief related funding, ARPA funding, that's helped kind of ensure access to state childcare subsidy. That underspending allowed us to create this pilot project, and we are now in the process of assessing long-term, strategies for maintaining this program as federal funds expire. Now, I also want to highlight that we have created childcare subsidy access for the county's workforce development program participants as well. And it's families in those same scenarios I discussed earlier. We've been budgeting $750,000 annually to support this initiative, and it helps residents who are in our workforce programs increasing their earnings. This includes the Urban League, the Charlotte Community Culinary School, and our own internal unified workforce development program. Nearly 150 households have utilized this resource with almost 200 children served. So just wanted to highlight those two initiatives because it's a huge impact for our families. And it's something that's really leading the way, not only in the state, but across the country in addressing these barriers to accessing or maintaining childcare. Briefly want to sum up some key challenges related to this issue. So as was shared and was clear through these slides, families at lower and middle income levels struggle to afford childcare. Childcare providers have difficulty finding and maintaining qualified staff because it's an industry that has inherently low wages, operates on very thin margins. Federal funding and ARPA investments that are expiring right now had helped stabilize the childcare industry in recent years. And even with subsidy, childcare availability can be limited across our community. I know you all hear from people every day facing that challenge. And it is a real challenge, especially for after hours or weekend care. And then key takeaways. So we talked about the major eligibility gaps and benefits cliff issues that exist, but the county has made significant investments to address these barriers for families. There is the need for additional and sustained investment from the federal and state levels, as well as the local business community, to really address the full community need that's out there. We've led the way, but we also have to have that support from federal, state, and business partners. And advocacy and engagement is critical to addressing this need. That's been part of this childcare related issues have been part of your legislative agenda and will likely be in future years as well. And the hope is that this information can help inform that legislative planning. So that wraps up my portion of this presentation today, and I am glad to take any questions.
Thank you, Mr. Nesbitt. As we did prior, we do like 3 minutes for questions until we get to about 10 minutes. But before we do that, housekeeping item, other committee member has joined us. I would appreciate if you would introduce yourself to the viewing public. And once Commissioner Leak has done such, I'm going to ask for approval of our minutes and then switch back to our question Q&A period. So Commissioner Leak.
Good afternoon. Good afternoon. My name is Vilma D. Leak, and I represent the most powerful district in the county, and that's District 2. And I'm sorry I'm late, but I was taking care of one of my constituents in one of my districts who's worried about the naming of a school and if his name would be on the school. So please forgive me.
Thank you, Commissioner Leak. At this time, I'd like to ask a motion to approve the minutes. They were sent to you electronically.
Second.
All right, been properly moved in second. Any discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. All right, our minutes have been approved. Thank you so much. Now let's go to questions. I'll start with Commissioner Powell, then Commissioner Leak, and then Commissioner Rodriguez McDowell. Commissioner Powell. If you have questions.
I do.
Okay.
So how you're talking about the 2-year pilot program. And how successful it's been. Or how many people we've served. But how are we working to make sure that they don't become dependent on it? Because you have this set up to help them through a hard time, but you don't want them to be on it forever.
And we've done a couple of things. So one is we've worked with our workforce partners to try to make connections where possible to workforce development resources. But this is one of the challenges that no matter what, this is going to be difficult for families at this earning level. The assistance, the need for assistance will always be there. So if you're at 220% of federal poverty level, you're going to need that kind of support. But that was something on the front end when we developed this program. We worked with Charlotte Works to share information with them about participants to try to encourage workforce connections as families were interested. But I want to highlight all of these families are working families. Sometimes they may be in a job they like, but there's not if you're still, even if you're earning 299% of federal poverty level, this assistance is still really needed for families or desired. So,
I don't know if that's the answer. Like,
yeah.
like the answer, like I'm asking they should be working and doing well at work and being promoted and coming out of poverty. How do we measure, like, are we measuring that? Are we measuring any kind of improvement since they are receiving a subsidy?
That is tracked, that information is tracked. We can kind of look at that. But I will say there's not a quick, so it can take time. If you're going from 200% of the federal poverty level, trying to go beyond or out of 300% of federal poverty level, that can take more than a couple of years. I will share that. I hear what you're saying. And that is data we do track each year about income earnings, but
that was the expectation of the
Yeah.
program when we implemented it. So you're absolutely right that this was a bridge program for them to help them with economic mobility. And since Child Care Resources manages this portion, they were supposed to have referred them to employment opportunities. All 2,000 people that are in the program, we're not working with them, but the eligibility was only, I believe, a year. It wasn't like an ongoing program or benefit for these individuals. So they had a year to actually find employment and to move up the ladder and then get off the program. So, and then this benefit isn't a forever benefit. We use a portion of fund balance to fund it to see if it worked. It works. People are using it and people are able to go to work and sustain employment. But it's not the goal to keep them on this program forever.
Because that's not sustainable at all.
Right.
Yeah, thank you.
All right, Commissioner Leak.
Let me first say thank you for your presentation. My concern is, and has always been, education to help alleviate the problem of having to be dependent upon this process. And we seem to be either not supporting strong education, not saying our district, but across this country, we're beginning to look at getting rid of public education. And our young Black males who are third grade and non-readers will be eligible for care, either with a parent, grandparent, uncle, aunt. How then do we tighten up education so that our people will not fall into this category?
it's a good question, Commissioner Leak, and I think that ties back.
That again.
It's a good question, Commissioner Leak, absolutely. And I think it ties back to that presentation we got last month from Reed Charlotte about the importance of and the early childhood education investments that we've made about just ensuring that early on in a child's life, they are being connected to resources, MEC pre-K, other opportunities, strong teachers, strong school system that helps people to have opportunities for economic mobility.
I hear what you're saying, but how then can we penetrate this process as we have today of violence, our young Black males, and the problems within our neighborhoods? How do we attack those problems to make life better for all people?
I think that might be above his pay grade.
Well, and I was going to say, I think we're doing, we have all of our work with the public health and the community violence team, and we have investments across all of these areas. So I think that's one thing we can look at between MEC pre-K and the early childhood investments, but also our public health's community violence prevention work that's being done. Tracy Campbell on Dr. Washington's team. We also have our behavioral health related strategic planning. All of these things are happening. These are all intersecting issues, and these are all challenges that face families across the community, particularly African-American families. And I think that's where it's all of these investments together totally that our goal is to drive that kind of impact, make that kind of difference that you're highlighting the need for households.
Thank you so much, but I still say, if we can get a handle on educating our children, but they must be in school. So there's a lot that we can do, and that we're doing economically. But I'm talking about being able to survive after 10 years. Where will these people be? How will we be able to support them?
Thank you.
Thank you.
Yes, ma'am.
Thank you, Commissioner Leak. Commissioner Rodriguez McDowell?
Thank you, Mr. Chairman. I know that it says it's a 2-year pilot, but did you, Mr. Trotman, did you say that it was a 1 year, each family could just have a 1 year?
Yeah, Robert, can you explain the eligibility process for each family?
Yeah, so when we started it, we would have, and I actually have Tim Gibbons here, so I may bring Tim up to talk about some of the eligibility nuance here. But we had brought families on, and then each year their income would be evaluated. We would give them the option to be, or strongly encourage their connection to our workforce partners with Charlotte Works. And then I think we would evaluate each year if it made sense to support continuing the benefit for a period of time. So it was assessed annually. But I think we tried to avoid making a simple, like, taking the benefit away from somebody if they were, say, seeing improvements in their household. So it kind of depends on each family's scenario.
But it's up to 2 years of eligibility.
Yeah, that's right. Yeah.
Yes. And then that's it for each family, unless there's a different determination made to keep them on longer. Is that the case?
Yes.
All right.
Okay, so, and are we able to track if this made a difference for that family? You know, like, I mean, I know this is since FY23, but is the plan to see, 5 years from now, like whatever, if they're doing better?
The goal would be to track that, and Tim, you want to speak to that?
Yeah, so there's a couple things with this program. Robert's talked kind of specifically around the benefits cliff over that 200%. But there's another component that's really challenging for working families where they get caught in a catch-22, because with state subsidy, they have very strict work hour requirements. So generally it's 30 hours of work a week, or there's some differential if someone's enrolled in school or not. So you found these families that were trapped and that they couldn't work 30 hours a week because they couldn't find a place to put their child and afford it, but they couldn't get a voucher to afford childcare, and then they couldn't get the 30 hours a week and they were stuck. So part of the piece that we did with this program was to provide some flexibility on work hours for families and give them 1 year to get up to the 30 hours they needed to work a week threshold. And then at that point, we could transition them on to state child care subsidy if they then qualified for that program. And then if they didn't qualify after a year and they couldn't get 30 work hours, which is where we would connect them to workforce development programs, then that's where we would make a determination to say, we have given you an opportunity to improve your working situation. If you haven't been able to do that, we're going to roll you off the program. When we talk about some of these folks who are in that 200 to 300% range, just to give you a sense, I just ran the numbers real quick here. So if you're talking about just a family of two, so for example, maybe a single mother and her child, at 200% of the federal poverty level, that's just below $41,000. And at 300% of the federal poverty level, that's just above $61,000. So just to put that in context, right? I mean, that's every teacher in Mecklenburg County, by and large, is going to fall into that gap there. And so I completely understand the question about not wanting people to be dependent and whatnot there. And so that's when we look at work hours, we do have very strict requirements. But I think there's questions on rolling people on or off that a single mother who's a MEC pre-K teacher is never going to get above 300% federal poverty level in 2 years, right? And so there are legitimate questions to ask how to manage that. But there are families that if they lose this, they have called us and said, I'm going to have to quit my job because I can't afford childcare. So we've provided more flexibility in those cases and been much stricter on the work hour requirements.
Okay, thank you.
All right. I'll save my questions, but what I hear, Mr. Troutman, is impacting outcome.
Yep.
What do we do to, from an interdisciplinary approach and a collaborative approach to move people from point A to point B is what I hear the commission is asking for those that can get there. I'll circle back a little bit later and talk some more about this, but childcare is something I had difficulty paying. I mean, we all have difficulty paying for childcare in this room if you had minor children and you all make good salaries. That is just a tough area for everyone at this particular point, and certainly well taken. And perhaps maybe we can do something. Churches used to have daycare because they reduced their fixed costs, or they contributed their fixed costs and just paid. So wages were different. My two children went to Central Piedmont daycare since they had years ago with Central Piedmont subsidized care and had appropriate compensation for the teachers and benefits for the teachers there. So that might be a big broader way of doing it, but the bottom line is, how do we help people move from here to here with the county's investments? And maybe we can partner with other folk to help us where we are limited in terms of what we can do as a government agency. Let me get Robert to introduce this last piece, and then we'll have a series of round robin questions for all of these folk as it relates to upward mobility.
Thank
Robert.
you, Chair Griffin. So next up, we have Tamika Couch, who is the Director, the Executive Vice President within Livian's Housing Choice Voucher Program, and she is going to give an overview of the Housing Choice Voucher efforts in our community.
Good afternoon. Thank you all for this opportunity to share with you all about the Housing Choice Voucher Program. Hopefully, mostly everyone here in the room have heard of the Housing Choice Voucher Program. It is 50 years old this year with the Department of HUD. So we will go ahead and start. So what exactly are the Housing Choice Vouchers? The Housing Choice Voucher Program is a federal government major program for assisting very low income families, the elderly, and the disabled to afford decent, safe, and sanitary housing in the private market. Since housing assistance is provided on behalf of the family or individual, participants are able to find their own housing, including single-family homes, townhouses, and apartments. Regulations for the Housing Choice Voucher Program are found in 24 CFR Part 982. The participant is free to choose any housing that meets the requirements of the program and is not limited to units located in subsidized housing projects. Housing Choice Vouchers are administered locally by public housing agencies such as ourselves in Livian. The PHAs receive federal funds from the U.S. Department of HUD, which is the Housing and Urban Development, to administer the voucher program. A family that is issued a housing voucher is responsible for finding a suitable housing unit of the family's choice where the owner agrees to rent under the program. This unit may include the family's present residence. Rental units must meet minimum standards of health and safety as determined by Livian. And that's right now is our housing quality standards, but we will be changing that over within the next year to another form. A housing subsidy is paid to the landlord directly by Livian on behalf of the participating family. The family then pays the difference between the actual rent charge by the landlord and amount subsidized by the program. Under certain circumstances, if authorized by Livian, a family may use this voucher to purchase a modest home. Another thing with the Housing Choice Voucher Program, it's not limited just to the area or the jurisdiction in which they are given the Housing Choice Voucher. We have a part of it's called portability, where they can go to any of our over 4,000 PHAs that's also administering the Housing Choice Voucher Program to best suit their needs.
that clicker. Okay.
I'm missing one. Okay. Okay, so this one just talks about our eligibility limits. These are given to us on an annual basis by HUD. And so for the most part, the eligibility for a housing voucher is determined based on the total annual gross income and family size, and is limited to US citizens and categories of non-citizens who have eligible immigration status. In general, the family's income may not exceed 50% of the median income for the county or metropolitan area in which the family chooses to live. During the application process, Enlivian will collect information on families' income, assets, and family composition. Enlivian will verify the information with other local agencies, employer, and banks, and will use the information to determine program eligibility and the amount of the housing assistance payment. So for the eligibility limits where you see that 54,000 for a person of 4, this is just when they are coming onto the program. Income can increase once they are on the program, but to come into the housing program from our wait list for a family of 4 would be that 53,000 for 2024. Okay. And then in Enlivian's Housing Choice Voucher Program, we have over 8,000 households participating in our program with over 1,300 housing provider partners. And we say housing provider partners instead of the landlords. I just wanted to make sure everyone knows. And then we have several different types of vouchers. Our most common is the tenant-based voucher. The tenant-based vouchers, these vouchers are assigned to eligible individuals or families, allowing them to choose their own housing from a range of private rental properties. Tenant-based vouchers are portable, which I've already explained, as long as the landlord agrees to accept the voucher. Then we have our special purpose vouchers. Special purpose vouchers are a category of vouchers within the Housing Choice Voucher Program that target specific populations or address particular needs. For example, we have the VASH program, which is the Veteran Affairs Supportive Housing. Though that program is allocated to assisting homeless veterans and their families. We have mainstream vouchers, which are targeted towards non-elderly individuals with disabilities. Then we also have we have the FUP program, which is the Family Unification Program vouchers to promote independent living and to sometimes bring separating families back together again, or the youth who have aged out of the foster care and are at risk of homelessness. We have the NED vouchers, the non-elderly disabled vouchers, who are targeted for non-elderly individuals with disabilities who are transitioning out of institutional settings, such as nursing homes. Then we have emergency housing vouchers, EHVs, which are they're commonly known as, they provide immediate housing assistance to individuals and families facing homelessness or at risk of homelessness due to a variety of emergency situations. And then we also have project-based vouchers. These vouchers are attached to specific rental units within designated housing developments. Project-based vouchers subsidize the rent for tenants living in these units. And then our home ownership vouchers assist families in purchasing homes rather than renting. The voucher provide monthly assistance to help cover mortgage payments. And so typically for that home ownership, we typically pay for 15 to 20 years for that mortgage. In Enlivian, we are a moving to work agency, also known as MTW. Moving to Work is a demonstration program that allows PHAs the opportunity to design and test innovative, locally designed strategies that use federal dollars more efficiently, help residents find employment and become self-sufficient, and increase housing choices for low-income families. In 2007, Enlivian became one of the original 39 MTW agencies. There are now close to 120 Moving to Work agencies across this country. Couple of the ones that I wanted to mention is the rent reform in 2010 as part of our moving forward initiatives, and Enlivian revised the rent calculation to an income-based step process with stepped escrow deposits. The income bands are a $2,500 range with a step rent being 30% of the range low end. For example, in a $5,000 to $7,499 annual income band, The low end of 5,000 is divided by 12 months of the year and multiplied by 30%. The total tenant payment required by the tenant would be $125. Annual adjusted income will be used to establish the income band. A ceiling flat rent was established at Enlivian's fair market rents for our project-based vouchers only by bedroom size and is reviewed and updated annually every fall. In 2018, Enlivian removed the escrow deposit and replaced it with two new incentive programs, the Challenging Barrier Programs and the Milestone Program. The income bands for rent calculation have not changed. Income earned by seasonal employment will be annualized if the employee has maintained employment for more than 60 days. Employees of temporary agencies will be annualized after an initial 30 days of assignments. Work requirements. Enlivian believes it is essential to create a clear and expectation that all applicants and participants who are non-elderly and non-disabled should work. To this end, Enlivian instituted a work requirement under which each non-elderly, non-disabled household will be expected to work at least 20 hours per week. The tenants and participants of Enlivian have support under the work requirement through the CORE program, which is the Creating Opportunities for Resident Empowerment. Case management is available to assist households with identifying strengths, removing barriers to employment, and achieving their goals towards self-sufficiency. And then we also have the exception payment standards. Enlivian received approval to implement exception payments above 120% of the fair market rent to the lower of the comparable market rent or 250% of HUD's published FMR. This request was made based on data from the State of Housing 2022 report conducted by UNCC. This report indicated that the largest rent increases have happened in the lower price segment of the market, with Class C properties having an average increase of 87.7% or 5.4% per year from 2000 to 2022. Additionally, the report noted that Mecklenburg has the highest average effective rent in the Charlotte region, with Gaston. So Mecklenburg is $1,567 for the rent, and then Gaston is $1,209, having the lowest effective rent as 2022. Okay, and then we just have some examples for households. So if we have a 2-bedroom voucher holder and the base they have a base rent of $1,500 and a utility allowance of $126. The tenant is only responsible for, say, the electricity in that unit. We gave the household members being 2 minors in the home and a head of household, and that's the reason for the 2-bedroom, because we do put same sex or same gender in the same bedroom. So the max amount of income to prevent the client from becoming over subsidy would be $63,000 annually pre-allowances. And so I know there's always big talk on our moving to work, especially the work requirements, and trying to say, are we pushing people away? No, we're trying to empower, and also with our wait lists being as long as they have been. I know we had a conversation about that prior to the start of the meeting. Sometimes they're over a decade, and so how to move people from it. One of the ways to move is if we have more people that are working, our HAP assistance goes down because the tenant rent portion will go up. And so we'll be able to serve more people if everyone can contribute to that actual for their rent as well. And another example is a 3-bedroom voucher holder, and based on rent being $1,500 and utility allowance $153. Again, this one would, for example, only electricity is in the unit. And so again, we have 3 household members. However, this time we did have a male. So that's the reason for that 3-bedroom. The max amount of income to prevent the client from becoming over subsidy would be $65,000 annually before allowances. For a 4-bedroom, example 3, for a 4-bedroom voucher holder, based on rent being 1,500 and the utility allowance of 182. And then we have the household members. And so the max amount of income to prevent the client from becoming over subsidy would be 65,000 annually before allowances. And that is all for the presentation. And any questions?
Thank you very much, Ms. Couch.
Ouch, yes.
All right. Before I go to Commissioner Lee, would be helpful if you put some really good information on slides 4 and 5, but if you could break that out for us in writing a little bit, that would kind of help us a little bit more.
Oh, absolutely. 4 and 5. Okay.
Yeah, 4 and 5 was particularly interesting, but it was just a lot of information. To
Yes.
Try to write. My shorthand is not that good anymore. Let me go to Commissioner Leek, then Commissioner Powell, and then Commissioner Rodriguez, McDowell, and then I'll follow up if I don't forget let me just take a privilege here. You mentioned a couple of things real quickly. The voucher program is only for Class C?
No, it's not only for Class C. That was for an example of how we came to that move to work activity, was using the Class C for the rent amounts.
Okay. I'll follow it up.
Okay.
We go to Commissioner Leek.
Thank you. In 1970, 71, we were being faced with the same problem of poverty and housing and jobs. So it's an ongoing process, ongoing for years. Little Rock Apartments was built by my late husband back in 1970, 71, and they're still there on West Boulevard. And I visit that site quite frequently and have conferences with the women and their children, because that's the predominant, the persons who find themselves there. Young women.
Yes.
I worry about this, again, going back to education, going back to being able to pay for childcare. My question is, who's first when they come to Charlotte with the voucher? Do they supersede the resident that's already here looking for housing? How is that handled?
So the last time the tenant-based voucher waitlist was open was in 2014. And at that time, we had 31,000 on our wait list.
How many on your wait list?
In 2014, when we opened the tenant-based voucher wait list, 31,000 people applied. We have no preferences for our wait list.
Did you say 31,000?
Yes, ma'am. However, now it's at 1,555, and we're continuing to try to exhaust that wait list. And that's one of the reasons why it takes so long when you allow 31,000 at one time get on a wait list. You're looking at years to be able to actually absorb that wait list and go through and exhaust it.
That worries me because I'm thinking about my senior citizens. Longevity is greater today than it was 20 years ago. So how do we support those who find themselves on Social Security, knowing that that income is not going to generate a move to be more compatible with their age and what they can do versus what they're going to receive? How do we handle our seniors?
Okay. For that one, I'm going to also ask Eric, our COO, to assist with that question. I know in Livian through our HDP, we're building as well, but I will let him kind of answer more towards that one.
Good afternoon. Can you hear me?
Yes.
So good
A
afternoon.
little louder.
It's got to be green.
Green.
There you go.
Okay. Good afternoon. My name is Eric Scott. I'm the Chief Operating Officer at Enlivian. But that's a good question because
Say that again.
that's a great question. How about that? But one of the things that we're faced with, not just in Livian, but just the, Charlotte and the Charlotte region as a whole is just what you said. There are more and more people that need affordable housing. And obviously the housing stock is a certain set limit of housing currently. So, I mean, the best way that we're trying to address that, of course, is to continue to, one, we're building new housing stock. We're developing ourselves, as well as partnering with other organizations, companies, developers who are building affordable housing. It's a very tough situation. We continue to think, I think another main way to do it is to actually have more partners. That's one of the things that we have to start working on, is having greater partnerships as well. If we can find partners that are building a senior housing, I see more and more senior housing coming up, 55 plus. Now, the thing is, we'll see if we can get them to start accepting vouchers. If we can do that, we can actually have more spaces for seniors as well. But it's a tough situation, but it really comes down to supply and demand, what's available to house seniors. And once again, as you indicated, people are living more, so there are more and more seniors coming up that are in need as well. And it's something that we have to just really keep trying to study and work on.
All right.
That doesn't help me much.
All right, Commissioner Lee, I'm going to go to Commissioner
That's all right. I'm
Powell,
good.
then we'll come back. Thank you. Commissioner Powell.
Thank you. Say it again. I think you said that it doesn't matter where they are in their income limit. In the queue of people waiting, you just go based on when they applied.
That's correct. Ours is time and date stamped for everything that we do. And so, yes, everything was time, date stamped for that.
And is that a federal rule?
Yes and no. You can allow for preferences for your wait list if you choose. However, it is not mandatory for a wait list to be established for an HCV. So you have to determine how will you go through your wait list. And so that is one that has been recommended and is not uncommon amongst a lot of PHAs. Every PHA I've ever worked at, that's how we've always done it, just because it gives more clear definition and everyone understands where they would be in that process. Once you start having preferences and everything, and you actually have to, once eligibility time has come around, having to make sure those preferences have actually, you have the paperwork for those preferences. That's the reason why so many are moving away from preferences as well.
So when you're going over how much it would take for people not to be eligible anymore, did you just show the 106,000 median family income just to show what the median is?
This one is actually from HUD. And so this is a direct thing from HUD. And so there was no way for me to want to cut that off like that. So that's the reason for that 106,000 for the median family income for the Charlotte-Mecklenburg area.
Thank you. That concludes my questions for the moment. Thank you.
All right. Commissioner Rodriguez-McDowell.
I don't have any questions right now. Thanks.
I might steal a question in here. The 1657 for Mecklenburg County, the 1209 for Gaston County is the fair market rate for a Class C apartment?
Correct. And that was back in 2022. So of course it may have changed here in 2024, but this was information provided in 2022.
So are vouchers limited? For example, for landlords to go up on the rent based on the fair market rate from the feds?
So for part of one of our MTW activities, we actually have asked for an increase. So we also understand that some areas may be an exception area where it's not uncommon to have higher rents. And so under our MTW activity, we do have authorization to go up to 250% of the FMR.
So in places in Mecklenburg County, rents differ.
Correct.
Southeast Charlotte's different from West Charlotte.
Correct.
Or the university area, or Huntersville, or Davison, for example. Is there any printed information about eligibility if you lived in Davison, for example?
No, and the one reason why we wouldn't be able just to have it just based on location like that is because ours is also based on census tract. So one part could be an opportunity area, but the next street over, if it's a different census tract, may not be a part of it. We do have a mapping tool that I could share as well. The mapping tool, it actually would, if you put different addresses in, it will let you know if it's in an opportunity area zone or if it's not.
Final question. How do you work with workforce development programs, or how are you connected to workforce development programs in Mecklenburg County?
So
Or
that,
if-
go ahead.
Or if you're connected
If
to
we are,
workforce
right.
development program.
So that's a great get it right. That's a great question because as Ms. Couch indicated, we're now reenacting our work requirement, which once again calls for all of our residents to work if they're work able. We are working with Charlotte Works. We have a partnership with Charlotte Works. We have a partnership with White Label Management. We're also doing some things with the county with Mech Success. But one of the things that we are looking to do now that we have initiated the work requirement, which is going to end up, I say in 2025, we're really going to see a big influx of individuals or property residents coming in, looking for work, needing training, because that's a deadline where you have to be working at least 20 hours a week.
Say that again.
There's a
sorry.
deadline that you have to work at least 20 hours a week.
In 2025.
Well, it started now, but now they're on a introductory period. Then they may be held on a sanction period if they're not working, which we continue to work with them to try to find training opportunities and employment opportunities. But once 2025 hits, if you're still not working, now that's going to be a situation where we're really going to have to dig in and figure out what we're going to do, because otherwise their subsidy is going to go down, which means their rent that they pay each month is going to go up. So we're looking for more partners to work with and more organizations that can provide job training, job placement services, things of that nature. As I stated earlier, that's one of the things that we really want to do moving forward, is to work with more partners because we only have a certain reach. And so we want to make sure we can expand our reach to assist our residents.
Thank you. I'm going to do an all-call alibi at this point. Was this the last presentation? Okay. Lowry?
I just wanted to add a little bit of information. I know there was a lot of questions about Class C apartments and if that's the only thing that you can use. I mean, Class A, B, and C has to really do with the quality and standards of the apartment building or where you're renting. So a lot of times Class A is going to be newer buildings, things like that. Anyone who's receiving a housing choice voucher can live in A, B, or C. What you find though is because HUD limits the amount that you can pay towards rent, many times people are living in Class C apartments. So I think that's part of the reason that they kind of brought that up, but you can live anywhere. But just because you're in Davidson and the cost is higher, there's still a limit that HUD will allow you to pay for rent. And that's a challenge. There is some flexibility, like they said, to go up a little bit, but keep in mind when you go up on what that rent is, you still have a finite pool of dollars. So you're serving less people.
Thank you. And that was my fault by asking the Class C question. So it wasn't your fault, it was my fault. And I apologize, Commissioner Howell, for doing that, but I'll get you the definitions for Class A, B, and C. They're very interesting. That's the last of the presentations, but we do have a few minutes. I'm going to look to my colleagues to see if there are any questions that you forgot to ask with respect to Medicaid or child care or the benefits cliff. If not, I'll call on my deputy county manager to not, let me make my comments before you close. Let me see if my colleagues have questions. Commissioner Rodriguez McDowell?
Nope, no questions.
Commissioner Powell?
Just real quickly, I'd like to hear from Mr. Scott again. I want to understand better the 2025 situation that you say is coming. Like more detail about it. And that's my only question.
So that pertains to our work requirement. And so, and I apologize if I made it seem like it was a dramatic event, because that's not necessarily the case. So we initiated our work requirement. All of our residents have to work, of course, unless you're senior, disabled. If you work able, you have to work 20 hours a week, a minimum of 20 hours a week. So right now we're in an introductory phase. So this is a chance to put you on notice if you're a resident that you have to have a job, we have a work requirement. So you can start looking for work if you don't already have work. A lot of our residents are working, just so everyone knows. I just want to make sure we get that clear. After that, then you start getting into sanctions if you're not working, which means we'll assist you with finding work, letting you know you're on notice, that time is running out. We need you to have a job. I was stating about 2025 that's when we'll take a look, see who's working, who's not working. If you're not working, then we really need to figure out what is taking place here. Why are you not working? Is there some limitation that you haven't told us about? And if you're not working at that particular point, it may be a situation in which you would receive a sanction in which some of your subsidy will be decreased until you find a job. So that's what I was referring to. But we don't know at
Can you
this point.
state FY 20, is it fiscal year 25,
Oh, I'm
federal
so sorry.
fiscal year
We're
or
looking
calendar
at
year?
sometime in calendar year 2025. Not at January 1st necessarily. I don't know the exact date, month, but it's in the year 2025, correct? Calendar year.
Thank you. That helps.
All right, Commissioner Leak, any one passing question?
My question is upkeep and taking care of the property that we have.
Yes.
Every 10 years, we are rebuilding these apartments, and housing is a major issue. How do we train people to take care of property? I drive through my district every 2 weeks and look at the apartments. Blinds are hanging. Screen doors are not there not well kept.
Yes.
So how do we teach us to value property and to maintain property and not tear it up?
So I appreciate that
Are we
question.
moving from one site to another?
Yes. So I know you came out to one of our resident meetings at Little Rock, and that was one of the things that you actually addressed, and you were very strenuous about that when you were addressing it. So that's also something that we're concerned about, because obviously preventive maintenance, taking care of your property, means that we do not have to spend as much money on repairs, et cetera, which means we have more money to put to our current residents into programs, things of that nature. So one of the things we do have is through our CORE program, or our resident services program, is a good neighbor program. So when you come onto the program, you're learning how to be a good neighbor, how to housekeeping, things of that nature, making sure you take care of certain trash goes out, blinds. We have a huge problem we do with blinds, that the blinds get torn up. One of the things that we also do is have inspections on a regular basis, and tenants can get fined for housekeeping violations. So that's something we're starting to ramp up as well. Another thing is, obviously, some of the blinds properties are older properties. So we have blinds that have been there for a long time, and they may be some of those thin metal blinds, especially when you have children, they're easy to tear up. So we're putting in much more sturdier blinds in apartments and units as we move forward as well. But the main thing is just the housekeeping. The property managers are tasked with making sure that we do housekeeping checks to make sure that people are keeping their houses in a clean manner, basically.
All right, thank you very much. We're at the end of our agenda, but I would like to, for my colleagues, my commissioners, to recognize an extraordinary event occurred on yesterday, and that is the birthday of our deputy county manager. So let's all say happy birthday to Anthony Trott. Happy.
Do you want us to sing?
All right.
Are we singing?
Let's sing into the microphone, everyone.
Longevity. You get penalized for living. Around this board, you would get penalized for living a long time.
But anyway, I want to say happy birthday and wish you many more to come. And it's a heavy load in terms of this area called Health and Human Services. The presentations were great. I was trying to do math at $25 an hour, $31.25 an hour, $37.25 an hour. So we're gonna have to look at the continuum of care, how we interact and partner with all of these partners out there that we provide funding for each year. Commissioner Powell, I wasn't on the board when you expanded the childcare piece, but what you said about the bridge program is what we should be doing for all of these programs. There should be a bridge or a stepping stone for those that can and are able to be up and out of this situation, given the fact that we are bringing in jobs with average salaries of $95,000, $100,000, et cetera. How do we partner with those corporations in terms of HR or embedding our people in those HR departments or finding out what the skill sets are so that we can close that gap so that they can get truly living wage jobs. So staff, team, Robert, everybody in this room, thank you for what you do each and every day, but we got to crack this nut on upward mobility because Mecklenburg County has a higher percentage of poor people than Wake County, for example. And so we're just going to have to figure out these wonderful opportunities to help all of our residents that are able to break the cycle, because this is a phenomenal community, phenomenal county. But so many of our people are left behind and not able to participate in the great benefits that we have in this town. So with that said, I accept the motion that we adjourn. Is there a second?
Second.
All right, been properly with the second. All those in favor say aye. And we are out of here. Thank you all for being here. Excellent presentations. Thank you.
Commissioner, I had one other thing I wanted to update you on.
All right.
And I wanted Tim Gibbons to come to the mic.
All righty.
And it's related to childcare, and there's a loss of childcare and federal incentives that's getting ready to occur. The federal incentives already have been lost, and now the state incentives are getting ready to be lost. And
So
wanted
what
Tim is going to address you
All right,
about the loss
Tim
of
Gibbons.
incentives.
All righty, let us have it, sir.
Yeah, so I'll just make this real quick, and Diana, please keep me honest on anything. So I'd say there's probably two things with a loss of funding that is either coming up or occurring that either impact the broader market or the county's investments in childcare. So the first, back during some of the relief packages during COVID, there were those childcare stabilization grants that were passed down to the states. There was an infrastructure component of those and then a compensation component of those. The infrastructure piece expired a while ago. Compensation recently expired. The governor asked for money in the short session. It was part of your legislative package. I do believe in the short session, they kicked the can a little bit down the road and they funded about 75% of, I think, what was asked. But that is going to be something that's going to continue to come up because that's helped prop up compensation in childcare to keep it somewhat competitive to other industries as wages have increased. So something to be aware of as that comes forward. The other big piece that just came up last month during COVID, due to those federal relief funds, Mecklenburg County had received a significantly higher allocation from the state for state childcare subsidy vouchers. So dating back to fiscal year 22, I think our allocation locally was around 57, 58 million. That jumped up over $70 million in both fiscal year 23 and 24. As those funds have expired and receded, our allocation this year for state subsidy vouchers was cut by about $10 million. And so both statewide and locally, for the first time in about 3 to 4 years, we have been told by the state to initiate a wait list for state child care subsidy, which we have not had to do because of those additional federal funds the last few years. So we do have a program that's been in the budget for years now that you've all continued to fund called our Waitlist Reduction Initiative Program, which funds vouchers for families eligible for state subsidy for children birth to 5, so they don't have to stay on a wait list. So in September, we just started re-enrolling families in that program. I believe it was 40 families or so that we just re-enrolled. But again, families who have children who are school age are not eligible for that program. So there are families who are going to have to be started to sit on a wait list and not activate and access some of those subsidy funds. So there'll be more to come during budget season. We need to kind of see projections about what enrollment looks like and everything there. But again, that was news that came down from the state last month, that wait lists are again in play.
Wow. You're alerting us to the budget cycle that's coming up potentially.
Yes, I'm alerting you to some loss of state and federal funds and making sure that you're aware if you receive a phone call from one of the child care providers, because the loss of the incentive funds means that they will not receive the higher reimbursement that they receive now. And I believe the state approved the budget through December. And so we've not participated in that. What we've participated in locally was wait list reduction, and we have funding set aside for that based off of your continued passage. So I believe we have $10 million set aside to reduce the wait list for birth to 5. We've carried those dollars forward because we didn't know when the state was going to stop providing the additional funds. So I'm hopeful that won't be a budget issue for us because of your support of this. But the additional reimbursement for child care providers, that could be an issue, as some child care providers may choose not to continue to stay open.
Well, thank you for that update. It just reinforces what all of the commissioners have said earlier. We got to make these bridge programs more effective because the funding is not sustainable across the board. So if we can do that, I think that's our charge for this committee and for this commission. So we've already voted for the adjournment. We thank you so much. Thank you for coming. Thank you for participating. Thank you.
This is staff over with the staff over here.
Yeah, they were housing authority, people in Medicaid people on the back row. Were Medicaid and the benefits folks to answer questions. The first part of it was this. The first part of it was just benefit stuff. Yeah.
I'll get some copy
Yeah.
of this.
Yeah,
Give to the ministers.
We need to follow up.
Tables in there pretty good. Table. Okay, all right.
Okay, thank you, darling. Thank you. Yeah. And what now?
Yeah, the tables in there are informative. These poverty programs.
They're going away.
They go.